So this is Colby, my son. He's now 4 years old. He was a healthy, vivacious, lively little boy. And when he was about 9 months old, he was shaken by his babysitter. The morning of May 20th, I got a phone call from Colby's babysitter that he had stopped breathing and that the paramedics were working on him. So I left work to try and get to him by our house, and the paramedics told me to go to Children's because they were going to airlift him here. Colby now has a feeding tube in his stomach. He can't take any food or medications or anything by mouth and requires everything through his machine that feeds him. Colby is blind. He has partial hearing loss, and he has no physical use of his body.
Abusive head trauma, the term that we now use, which was formerly called shaken baby syndrome, can have many effects on a baby. Since 2008, there's been a doubling in the United States of cases of abusive head trauma, and here in Seattle, we've actually seen a tripling. After seeing this rise, Children's did an amazing job of creating a task force that worked with different multidisciplinary agencies and looked at what programs are out there that really can help parents.
When Lucy was born, we were given a Purple Crying DVD, and the nurse explained it to us that, you know, babies hit an age where they cry a lot and you might not be able to console them, and I just kind of thought, oh, okay, whatever. And we got home and the first couple weeks were okay, but sure enough, around the 2.5, 3 week mark, she just started to cry all the time.
Hearing her cry was really hard for me just because I felt like I needed to fix it. That's my, assumed role, is to be able to fix things around the house. And so the baby's crying and I felt like I needed to fix the problem, and it couldn't do it.
We watched the video. I think you remembered we had it and put it in, and a sense of relief came over us just because we realized, okay, this is sort of normal.
Crying really is the #1 reason why children are abused. The Period of Purple Crying program is a video-based parent education program that teaches parents how to safely deal with their children during periods of crying or periods of stress. The program was initially started in birthing hospitals around the state and was very successful. And what we found is that reinforcement of the message was very important.
For me, the Period of Purple Crying information is really helpful for parents to really normalize what they're experiencing. It's a very isolating time in their lives. They're usually home alone with this child. How about crying? How is crying going?
He only cries when he wants to.
Okay, so he's pretty easy to soothe then?
Yeah.
To be able to normalize that feeling and to let a family know that their child is okay, that they're not doing anything wrong. Being able to have that conversation is oftentimes very freeing for a family. Now, when you were in the hospital, did they talk to you about a normal developmental stage that babies go through with crying? I have seen that there are hospitals in our city that do give out the Period of Purple Crying video, and then we also are able to give it to our patients as well here at our clinic, and it's just a nice conversation starter, a good way to comfort a family.
The task force has made great progress so far in reaching approximately 60% of all new parents. The ultimate vision is to disseminate this information not only to parents, but to the general population as a whole, so that they can better help support families during this stressful period.
The Period of Purple Crying program has brought a lot of awareness to hospitals with new parents and teaching them about taking a breath, taking a break, and putting their baby in a safe place and walking away. It's very important for parents to understand, and caregivers, or anybody really who's going to help take care of the little babies, to walk away and not shake a baby.